Medications that affect fertility in men. Hello, I'm Dr. Kady. Welcome here to HeyDoc. On this channel, I talk about women's health, fertility medicine, and pregnancy-related issues. I'm a board-certified family doctor. If this type of content tickles your fancy, be sure to subscribe. It's almost impossible for us to talk about fertility issues without looking at male-related factors. This video is crucial because many are the men who are actively trying to start a family without being aware that there is a drug that they are taking or a few drugs that they may be taking at the same time that is affecting their sperm count or even the quality of their sperm. So this video is purpose for all men and their women to go through the list that I'm about to talk about and see if you are on any of these drugs. Remember, if you are, don't just stop these. Discuss it with your own doctors because some medications cannot be stopped abruptly. Diving right into talking about these drugs, the first drug class we're going to address are the anabolic steroids. As many will know, these drugs are purposed to enhance the performance of athletics and for men who are keen bodybuilders, so they want bigger muscle bulks. The effect of these drugs on fertility is that they cause the testicles to shrink, and this has a knock-on effect on the production of sperm cells because shrunken testicles lead to lower testosterone levels. And remember, you must have a good testosterone level in order to produce a good number of healthy sperm cells. And the reason why it's important for you to be aware that anabolic steroids can lead to infertility is because any man that has used anabolic steroids for a long period of time, in other words, they've been on it long term, it can lead to an irreversible low sperm count. Talking of low sperm count, I've done a video on this channel that looks at the semen analysis, what the different parameters mean, and whether or not a low sperm count can be reversed. It is well worth a watch. Next on the list are different chemotherapy drugs. Chemotherapy drugs are very often used to treat cancer, and that can be cancer of any part of the body. Many chemotherapy drugs, particularly the alkylating agents like cyclophosphamides and cisplastins, these chemotherapy drugs damage the sperm producing cells in the testicles, leading to either temporary or permanent infertility. Of course, it will depend on various factors like the length of the treatment course, the dose of the drug, whether the chemotherapy was combined with radiotherapy. So whether or not chemotherapy will cause permanent or temporary infertility will depend on all of these factors. That said, if you are a man who is in your reproductive years, either a young man who hasn't started a family, or even if you have had a family, you are still wanting to have more children and you get given the unfortunate diagnosis of cancer, the doctor should have that conversation with you about storing your sperm cells. It will be like the egg freeze that women do. You should be given that option if you still wish to have a family.